Today we are going to talk about how to properly use our mask. So for the first step, we have to be aware not to reverse our mask. For the mask, we have normally three layers, and we are talking about surgical mask. The outer layer is a blue-green surface, as you can see in the picture, and it is waterproof outer layer. It will help to block external droplets such as virus. So it is very important that the blue side face outward. And for the middle layer, it is the filter layer and it will also block viruses. For the white layer, which is shown here, it is the inner layer and it absorbs the moisture of exhaled air. So there is the outer layer, the middle filter layer, and the inner layer. So we would make sure not to reverse it when we wear our mask. So the blue side is always at the front facing others and the white side is always facing ourselves. The function of each layer is different, so it cannot be reversed. Of course, there are some masks where both sides are white in color, so we just need to be aware for the instruction which one is the outside waterproof layer and which one is the inner layer. Number 2, how to fit our mask perfectly. So we can see in the model that he is wearing a surgical mask. One side of the surgical mask contains an iron wire, so we can see here. So the iron wire is facing outward. We need to compress the iron wire to make the mask fit our nose bridge and face shape. So the iron wire is always near our eyes and it cannot be near our chin or in any reverse manner. If we see this picture, it will be clear. You see the lady, she is compressing the iron wire to make it fit her face. And if you see this diagram, we can see that for the first step, we should make sure the mask can cover our mouth, nose, and chin with the collar side facing outwards. And we compress or pinch the metal edge of the mask so that it presses gently on our nose bridge. And thirdly, when we remove a used mask, we hold only the ear loops, so our hands will never touch the surface of the mask because it is full of virus. To be effective, we should change mask regularly or if it is wet or soiled. When we put off our mask, it is better we rub it with tissue paper and then discharge it in a rubbish bin. And after we take off our mask, we must wash our hands with soap and water. Number 3, don't touch the outer layer. After the surgical mask blocks any virus, the virus can still attach to the outer layer of the mask and survive for 7 days. So you should avoid touching the outer layer of the surgical mask. As you can see, the virus will stick to the surface and it will remain there for 7 days. So don't touch the outer layer of the surgical mask. And also, when we wear the surgical mask, sometimes we will rub our eyes or we do other little gestures, which is also not good. Number 4, surgical masks can be used only once, and some even suggest that we can only use it for 4 hours. But of course, surgical mask is very expensive and rare to find nowadays, so most of the people will wear it for one go and throw it away. Please don't keep it overnight, because the mask can be used after absorbing the exhaled water, so it is designed for single use. So, as you can see in the picture, we cannot reuse our surgical mask. Cloth mask has the function of keeping warm and absorbing the moisture of the exhaled air. So we can use the cloth mask to absorb the exhaled air, but they cannot block virus. Cloth masks can be washed and dried for reuse. So there are two types of mask. We use the cloth mask but not the surgical mask. So if we wear a cloth mask inside, then we wear a surgical mask outside, we can let the inner layer absorb our moisture when we speak and avoid getting the surgical mask wet. So this can extend the use time of the surgical mask, and we can reuse it when the surgical mask is insufficient. However, you see in this picture, it is a wrong idea to do that because the surgical mask, we need to avoid it to absorb our moisture, right? So actually the surgical mask should be placed outside and the cloth mask should be placed inside. So we always remember the function of the cloth mask is to help us absorb our own moisture, while the surgical mask help us prevent the virus from sticking to our nose and mouth. So the surgical mask, the blue part is always outside and the cloth mask is always inside. So how do we store our mask? If, for example, we went outside and then we do some shopping and maybe later on the same day we will go out again. So the best way is some people will design a case, but for me, I will put a tissue paper on the table first and then put the mask on top of it and then put another paper. But be sure you know the direction and never touch the blue part of the surgical mask after it is used. So if you have any problem, you can always let me know.